Hello, doctor.
Is it okay if I ask you some questions?
Okay.
Diana is a simulated patient in a simulated doctor's office, but the skills she's teaching medical students are very real.
In addition, there's some clips.
Dr. Scott Lynn, Chief of Surgical Oncology at the Medical College of Georgia, is working with the University of Florida to help medical students master the art of patient interview. By interviewing a virtual reality patient, medical students can practice the right questions to ask as well as gestures and eye contact.
Well, the project got started when I was at the University of Florida, and I interacted with a computer scientist there, Ben Locke, who was looking at applications for virtual characters. These are computerized simulations of humans, like you see in the video games that our kids play.
So, what brings you here today?
Well, a couple of days ago.
The standard method that's used to teach and test communication skills involves standardized patients, which are actors paid to portray a patient. And the virtual patient we've studied related to, or side by side in a comparison to standardized patients, and it looks like it does teach some of the basic communication skills.
I can remember my first year of medical school when we had limited number of standardized patient interactions, and the opportunity to get feedback we only had once, where we actually had to watch ourselves on a tape of ourselves with our classmates, and that was a little anxiety provoking. And I think having the chance to practice in an environment where there's no judgment, things like that would have probably helped, and I think it would have been beneficial.
Initially going in and doing an interview with a real patient can be intimidating. If you lose your place, forget what you're supposed to ask. Working with a virtual patient,
Hello, doctor.
you have time to work through some of those issues, and I think that's really valuable. It's also good for difficult questions, sexual history, things like that.
It does allow the upcoming medical students much more familiarity with the technology. They've used it before in video games. They're not afraid of it, and so they're much more likely to embrace it.
Standardized patients, while excellent teachers, are limited by their availability and their cost, and so if we got the virtual patient system to the point where it was readily available with multiple scenarios, we could see it being used on a regular basis by students, and hopefully helping them improve their education.
The next step for MCG is integrating the virtual patient with a new simulator that measures the amount of pressure a student applies during a simulated breast exam. From the Medical College of Georgia, this is Kim Miller reporting.